is having one shaft and two ends. And they are having like this structure. This is known as cancellous bone. Cancellous. Why it is called cancellator? And this part, if you look at this part, the compact, that is hard. There is of further two types. Woven bone and one is the lamellar bone. These two terminologies, woven and these two terminologies, they are based on the collagen orientation, collagen fiber, how they are oriented, how they are organized. If arranged somehow, anywhere, that is the woven bone. If in a particular direction, then lamellar bone is present during your embryonic. This bone is present adult animal body. This bone is also present in adult, but at the time of fracture. When there is fracture, first this bone will be formed, then further it will be replaced by the bone. That is known as the remodeling of the bone. So, we'll start story from this part. Compact type, compact lamellar type. We'll see woven bone later. Compact lamellar bone. We'll take one section of this bone. And if we take the transverse section of this bone, this is the marrow cavity, and here like this. These are known as structural unit of your compact bone. This is known as unit. It was asked in ICAR 2019 exam paper that OS is also known as Haversian. This structural unit is called as osteum, and the another unit is Haversian system. So in that exam, that synonyms was asked, is known as osteum. So these circles, they are the structural unit of the compact lamellar bone, and these structures are known as osteon Haversian system. If we see one circle, one osteon, the diameter, the size of this osteon 20 to 100 micron, and in this diameter there are multiple circles. There are multiple. How many? 20 circles. And these circles in osteology language, these concentric circles are called lamina. So what we are doing, we are studying compact bone, and in the compact lamellar bone. This is the bone transverse section having marrow cavity, and these are the osteons. These are the osteons. One osteon out, then within this osteon, centric circle. If you look at the center, there canal. There is in the center central canal. Canal as Haversian canal. This canal, some these are there. Fine are there. So in the center we have central canal. Outside of this there are many circles. Five, they are called as lamellae. They are called as lamellae. So this is lamellar bone. It means in case of lamellar bones, if we see how these fibers are arranged, how they are oriented. This is one of the osteon which is having like this multiple. If we look at the orientation of this collagen fiber, then it will be like this. This is one lamella. This is another lamella, and this is the number 3. And in the center, as I explained here, in the center, what is there? This is the Haversian canal. So in these lamella, what are arranged? Collagen fibers. How they are arranged? How they are arranged? They are arranged spirally. They are arranged spirally. But they are arranged like this. But if you look at alternate lamellae, alternate second or third. In case of alternate second, the direction changes to 90 degrees. Then in this they are like this. Like this. So this is what is called lamellar bone. In case of bone, these collagen fibers, they are oriented in a pattern. But one lamella is having orientation. Next lamella is perpendicular to this, and third one is again. So are same like 2, and if I make one more, 2 and 4 will be. So spiral arrangement, but alternatively they are right angle to each. Why this arrangement is there? This arrangement will give two forces. If something low weight is there on the bone, such arrangement will provide more stability, and this is called lamellar arrangement. Instead of this, if you look at if I draw the lamella of a woven bone, then it may be like this. Even in one lamella, fibers are oriented randomly. They are random. Some fibers like this, some fibers like this. That is known as the So this is the difference. How these are oriented. Next, this is the osteon or Haversian system having this canal. These two osteons, they are connected by something called as Walkman's canal. They are connected. This circular arrangement, they are known as lamellae are of four types. They are four types. First is Haversian lamellae. Second is interstitial. Third is outer circumferential, and last is circumferential lamellae. So in side one osteon or Haversian system, this is the cross section, narrow cavity, and this is one osteon. If I bring this out, then Haversian canal, these are the lamellae. Because they are present in Haversian system, they are called as Haversian lamellae. Similarly, one more. Those in between two Haversian systems, HS, interstitial. In case of interstitial lamellae, Haversian canal absent. In between the two Haversian system, lamellae are present, and in these cases, Haversian canal they have lacuna, osteocyte, they have canaliculi. These are present, but Haversian canal is not there. They are called as interstitial. Next type of lamellae periosteum. Inside the periosteum, these are called as outer circumferential lamellae. The good thing about these lamellae is this periosteum, which fibers? Sharpes fiber. They anchor this periosteum to the circumferential lamellae. This is the point up to where you can find sharp. So this is outer circumferential lamella. Narrow cavity. Outside this is lined by the end osteum. End osteum. Outside the end osteum, you can find inner circumferential lamella. So lamellae, one is outer circumferential, inner circumferential, Haversian system. Here in here you have interstitial lamellae, Haversian system. In between Haversian you have interstitial lamellae. Inside this, inside these are Haversian lamellae. So total four means four type of circle are present. One just beneath the periosteum, outside the endosteum, one in between the Haversian system, one inside the Haversian system. The total four types. The if you inner, circumferential, and in between interstitial, and this is Haversian. If you look at the structure of one lamellae, if you take any lamella, outer circumferential, or it is inner circumferential or Haversian, the structure will be same. It will be and inside this what is present is your ost- the osteocyte. This is the osteocyte, that is bone cell. The good thing about the cell is it is present in lacuna, empty spaces. So if this is one another lacuna and inside this these osteocytes are present, they communicate with each other with some canals. They are not canalicule. So within one Orthopaedic system, if you are looking at one circle, we bring this circle out. In reality, this circle forms like these structures. What are these? These empty spaces are lacuna. Inside these lacuna, osteocyte, which are having processes coming out. Processes, they are communicating with each other. Communicating with each other. How they are communicating? Communicate these structure called as canali. So lacuna with one osteocyte. This is lacuna with one osteocyte communicating through the canal. They form one lamella, one concentric circle. So this is the inside structure of a single lamella, where osteocytes are present inside the lacuna, empty spaces, and they are talking with through the canalicule. This is how a compact bone is arranged. These are ends. We are talking about this part, that compact bone. How it is arranged? It is arranged like this. outer circumferential lamella. This is bone marrow cavity. It is inner circumferential lamella. This is osteum. These are osteum. That center is Haversian. The two Haversian canals also connected like this by canal. In between, these are interstitial lamella. These are Haversian lamella. If lamella this outside, then that will be consist of with some osteocytes talking with each other through these canalicula. This as can I explained finally. If we see this collagens are arranged spirally. How then like this. Direction. That is called the lamellar bone. If these collagen fiber in one lamina, if they are arranged like this randomly, then it will be called as woven bone. Still, it is compact because of this collagen fiber. The woven bone, and that is at the time of rupture is known as syllabus. Okay, after this compact bone, one more point with this. Uh, See, this is your lacuna where osteocyte is there. Osteo is there in the space known as lacuna. If instead of osteo in this lacuna, who is saying that ruffled border multiciliated osteoclast. If this is sitting in the name of this lacuna, ships, this is called lacuna. Where the bone discovered by the scientist how ships therefore lacuna. But these lacuna they are simply known as like empty spaces. Only the difference of bone and cartilage. Bone and see lacuna is there in both the cases. Lacuna is there. But here only one cell, that is one. You will find two cells. It means osteocyte. Here two. This is the difference. And these cells are these. And these cells they are is having some cytoplasmic process. So this is the level of lacuna and this process. So if we see between and cancellous is hard, easy difference. Where these ends like this. These are known as bars and plates. These are these are bars and plates. So they have spaces in between. These spaces are known as canceli. That's why the name cancellus. So in case of cancellous bone, if we look at there in lamella or Haversian can present tion, that is the structural unit. If we look at this porous, if we look at the porous structure, this in but these lamella organized in the form of osteon, means osteon Haversian system is absent. Lacuna present in osteocyte present communicating via canali. So in the if you look at the difference present in case of cancellous bone, but here the that is the difference through the present. This compact bone, it is having system everything, and this is called cancelli. Idea what kind of screw we compact screw we screw. Compact screw means a screw, this is a screw whose threads are very compact. These are the threads, they are compact, very compact threads near to each other. One will give us idea that screw which is having compact, but this is porous. G. It will an idea to use cancellous or something loose screw. Bone is loose, bone is cancellous to use cancellous screw. What does it mean? This is these threads should be loose, loose thread. Loose are something far apart. There is gap. The distance between these threads is more. See, these threads are very near, very compact thread. So we use compact bone. Which is compact? Obviously cortical. And which bone is cancellous? The bone is cancellous, spongy, heavy. We use loose screw called. These are called as cancellous screw. Anatomy of the bone, we take the advantage. We design as cortical and cancellous screw because it is compact and they are cortical. Because it is cancellous, spongy, having space, we use our screw which are loose enough. So the next topic, which is the main topic of orthopedic, is the what is the role of screw? C word. R for what they convert? They convert rotation force into linear or axial force. To convert into axial force. This is their main function. If you look at the in your ICAR 2019 CQ, that was related difference between cortical and cancellous screw, and this difference was asked based on the morphology of the screw. Because first we'll see morphology of the screw. Morphology. This is known as head of the screw, and this is known as shaft and tip. Very simple. Head, shaft, and tip. Make something like this. These are known the language. This terminology for these is not. These thread may be present fully, then it is, or if this thread here, it is called partial threaded screw. The head using commonly in our practices shape is the hexagonal. It may be shape, it may be oval, but what we are using is the hexagonal head. Shaft is our threads. Next, the most important part is the diameters. This is shaft. This diameter is known as core diameter or inner, and if I make threads, then this diameter, including the thread, is known as thread diameter or outer diameter. Outer. So why to study these two diameter of thread? If you go to market, if you ask the that give me 3.5 screw. If you 5 screw, then clearly understood by that seller asking about the thread diameter. You are asking about the outer diameter. So size of the size of screw in the market is available by the this diameter 3 point. It is screw. Here you are talking about this diameter. If it is partially threaded, if it is partially threaded, it means your size 0.5 means this diameter, this 3.5. Note this shaft one. So size of a screw from which diameter? This outer diameter or thread diameter. If you screw, then you will be selecting with the help of this diameter. Concept of thread diameter. Next thing, there is one term called pitch. Number of turns per inch. Number of turns per inch. Suppose there are two. This is cortical and this is the cancellous. This is cancellous screw and this is cortical. I explained to you because cortical bone is compact. So we are using compact thread. Thread should be near to each other, compact. Because the bone is cancellous, so what we are using? Loose spongy screw. If you look, suppose this is 1 inch. Pitch means number of turns. In this 1 inch, 10 turns are there. If this is 1 inch, how many? There. 1, 2, 3. So which screw coating having high or low pitch? More number of turns, high pitch. Less number of turns, having low pitch. This is the difference between and cancellous with respect to pitch. Next is thread height. Thread to outer diameter minus core diameter. This is the screw. This is the core diameter. And if I make the thread diameter is the thread diameter. The difference between these thread height. So what does it mean? It means such part, this height, this part, which is this part is known as your thread height. The part which is just outside this part is known as the thread height. In ICAR exam, they have asked which of the following screw is having. So if I draw both the screw and incidence, then obviously go very close like this and cancellous. So this height is more to this height. So cortical screw, they more or greater thread and they have less thread height. These threads are there and they are asking about the height. So this height is more, this is less. Are the four differences and these were the four year exam. Now if I summarize them, incidence and cortical. Cortical screw are usually fully threaded. They are cancellous screw. They may be partial or partial threaded. This is the difference. Second, about the pitch, number of turn, high pitch and they have low pitch. Low pitch. Number 3, thread height. See, height is less. Thread height and they have more thread height. Number 4, it's okay, head, take, huh. Number 4 is use. Where to use? They are compact, so use them in cortical bone. Where to use? Use them in epi or use them in metaphysis. Or you can use them in short bone. They are also having more spongy cancellous. So this is the difference. So as I told you, nomenclature means size of the screw that is given by this one. If I say 3.5 mm screw, it means they are talking this diameter. Now size available in the market 1.5 to 6.5 mm screw are available. 1.5 means that screw 3.5. 6.5 means this big one which is having thread diameter of 6.5 mm. So these are the difference. Cortical and cancellous screw there is one term, screw. Locking screw means the head is also having thread. If you threaded, then it is called locking screw. Where it is used, locking company LCP. In case of LCP, the head of the screw is also. Then suppose this femur, your, and there is fracture, oblique fracture. There is oblique fracture. You want to use screw. How to select size? Answer is 25% of bone diameter. You are applying one plate here. It should be 25% of the bone. It should be 25% of bone diameter. Hello.
हेलो
हाँ, ऑडिबल है ना सब कुछ? इट्स ओके ना?
हाँ 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 सर सही है
Okay. So there is one concept of leg screw. Leg screw. Principle. Leg screw principle. What is leg screw? Any screw can be used. You can use cancellous, you can use cortical, fully threaded. You can use any screw as a leg screw. What is the principle? The principle compression. The principle. What is the meaning of compression? Suppose there is one oblique fracture and you are applying one screw. You tight the screw. It will compress. It will compress the fracture. So this is the of the fracture, and this is interfragmentary, and we are doing compression of this fracture fragment. So leg screw, any screw can be used as leg screw, whether cortical, cancellous. What is the principle? Compression. What we do, we compress these two ends, which we tight the screw, both ends are to each other, there is compression. So where to use? Which kind of fractures? So we use fractures. In case of oblique fracture, we use them perpendicular to fracture. We use them a fracture line. For example, this is one. This is the oblique fracture. We use our leg screw this perpendicular. Question is, why to use them perpendicular? Little angle to perpendicular, then what will happen? If perpendicular use, then what will happen? Then shear forces, these fracture fragment will be displaced. Means they will slip each other instead of compression. The fracture line, and this is the angle. If we use them, then both are compressed. They come near to each other. If your angle is not good, this suppose this is the fracture line and you are putting like this 90 degree, then these fracture end will displaced, slipping over each other. They will not compress in a perfect manner. The first important rule, apply leg screw perpendicular to line. Then steps. How to apply leg screw? How to apply leg screw? As we know, we have two cortex. Cis cortex, that is the near cortex, is the this is the trans cortex. We do, we drill holes. We drill two type of hole in two cortex. Big in cis cortex and small hole is drilled in trans cortex, is known as glide hole, and small as thread hole. Our first aim point in application of leg screw. This is the first point. Drill hole, big hole in the cis
Hello? Hello, sir, you are not audible. Hello? 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 Hello, sir? Hello?